Professor, thank you so much for your time. Look, we know lockdowns work, right? It's been proven. They reduce transmission because simply people aren't interacting with each other. There's not aerosol passing between one person to the other. The thing is, are restrictions the only tool in the Australian government's armoury?
Well, clearly not. When we say Australian government, we should be talking about Australian governments, because we have a devolved system of healthcare in Australia where the states do most of the healthcare and in our case, most of the pandemic response. And every state has approached things slightly differently. But I think what is consistent across all the states is that they're not just looking at lockdowns. Obviously, lockdowns are done in order to allow test and trace, contact tracing, isolation of infected people to scale up and contain the epidemic. But we're also asked to do a whole host of other things, like wear masks when we're indoors or when we're visiting the supermarket, and a number of events are being cancelled. I wouldn't say harsh lockdowns in most of Australia, but a multifaceted approach.
Yeah, I mean, I suppose I kind of asked that because if you look at the list of countries and how many cases they've had, Australia is about 125th in the list. And therefore, it's actually dealt with it really well. But one of the ways that we as outsiders see what Australia's done is, well, hold on, the country's completely shut itself off from the rest of the world. And then you get 1 or 2 cases in a city and the whole city goes into lockdown. And the rest of the world's looking at Australia and thinking, hold on, we're dealing with the virus in a different way. And if we're lucky enough, we're actually having vaccines put into our arms. But there's a certain hesitancy in Australia. Very few people have been vaccinated.
I don't think there's a hesitancy, and I think the reason why fewer people in Australia have been vaccinated than in other countries relates to availability of the vaccine. So I think our government put too many eggs in one basket early on in the pandemic, relied, I think, too much on AstraZeneca, which we can actually produce locally, and didn't probably do enough to secure the mRNA vaccines like Pfizer and Moderna. And so then we were caught on the back foot when AstraZeneca was found to be associated in rare instances with clotting disorders, and that then led the government to rethink and to seek more of the mRNA vaccines. And so that's why we're behind. It's not because of widespread vaccine hesitancy, it's because of the delay in availability of vaccines. Like every other country around the world, we're seeking to vaccinate our population. We're seeking to get high vaccine coverage because that's the only way that we'll get out of this situation.
How do you feel possibly that the attitude of Australians differs to people in other countries in the world? I mean, in terms of how they're behaving, because the virus hasn't affected Australia like it has so many other countries, do people, do they understand the virus? Are they particularly scared, or are they quite relaxed about it? How do they conduct themselves?
Well, it's a bit of everything, but I would say most Australians are acutely aware of the virus and the havoc that it's caused overseas. I think we're all very concerned about the virus taking off in our communities. By and large, I think the public has been highly compliant with social distancing or lockdowns or whatever public health response is required at any point in time. I think there's a high degree of political capital with our government. I think people tend to trust what the government's saying, because the government takes scientific advice and acts accordingly. So I think by and large, the Australian public has responded very well. I think it's true to say, however, that Australians haven't experienced the full devastation of large numbers of people dying, hospitals falling apart, people not being able to access ventilators and oxygen supplies that we've seen in other countries. And so I think that the full horrors of the pandemic haven't played out here. And maybe there is a small element of complacency in the population. But, we're very fortunate here that we haven't experienced that, and hopefully we won't.
Absolutely. Everybody would back you on that one, Professor. Thank you so much indeed. Archie Clements from Curtin University.